Molnupiravir is a pill that could cut the risk of COVID death by about half. That's according to interim testing data released by the drug's American developers.
The treatment is not yet approved for use in the U.S., but there's already a global rush to place orders. Taiwan is in talks over a purchasing agreement to lock in a supply of this promising pill.
U.S. pharma firms Merck and Ridgeback Biotherapeutics have released interim trial data on their oral drug for COVID, Molnupiravir. The findings suggest the drug can reduce the risk of death and hospitalization by 50%. But a Taiwan doctor warns that the pill is not a panacea.
If you have breathing difficulties and your oxygen levels are dropping, oral drugs may not be the way to go. Injections may have a better effect. Right now, we don't yet know whether there are any differences between oral and injectable treatments. In any case, injections are more reliable in terms of absorption. They aren't affected by the absorption rate of the stomach and intestines.
The digestive system's absorption rate can affect the effectiveness of oral use drugs. The CECC is currently in talks to procure the drug, which is a pill that's taken at home to reduce the risk of hospitalization. Currently, Taiwan administers remdesivir to patients receiving oxygen support in the hospital. Monoclonal antibodies are given to at-risk patients with mild or moderate symptoms. The new pill would be prescribed to high-risk patients with recent infections. Health experts say that once a patient develops severe symptoms, it's usually too late to administer any drug.
The thing about these three drugs is that if you take them after you develop severe symptoms and become hospitalized, their effects may not be as pronounced, or they may have no effect at all. These drugs need to be taken when symptoms are mild, right when the virus starts reproducing. That's when you can inhibit it. That's when the drug will have an effect.
The CECC advisor says that any of these three drugs, if administered early, can reduce the risk of severe illness and death by 60 to 70%. With the epidemic contained, the CECC is securing the supplies required to fight another outbreak.